Hey guys, welcome back to the Seclair podcast. We have a table full of people going on right now. So I'm gonna again, this is Mike Sorg, the director of web media here, and we're just gonna go around the table to start things off. Everybody, just kind of tell us your name. I know we have some students with us. Just tell us, where you're from and everything. We'll just go around.
Hi, I'm Nancy Livingston. I'm a PA student at Duquesne on my first rotation.
Hi, my name's Ashley. I'm Seton Hill University student, and I'm on my third rotation right now.
I'm Julie Margo. I'm the Reiki Master here at Seclair.
And I'm Tirzah Mason. I'm a psychotherapist here at Seclair.
I am Mariangela Marcuso, and I am the yoga therapist here, and I present meditations.
And I'm Rachel Kusha. I'm a PA student from Duquesne University doing a rotation here at Seclair.
Rachel, you wanted to introduce this topic. This was kind of an impromptu one that came up today. You want to tell us what's going on?
What we're talking about today is really using music as a means of medication. As students here at Seclair, we've recently experienced the therapy that music can really present to patients, whether they're psychiatric patients or maybe with an array of medical conditions. We've been able to experience firsthand how it can really change the entire environment. It can change the mood. It can completely alter the surroundings and bring someone who's maybe going through difficult times or tribulations and bring out this life in them that perhaps a medication couldn't. So what we're talking about today is just medications as a whole, how their prices have skyrocketed and how media portrays them and how it's this whole world of marketing versus what music can really do as a means of self-soothing, as a type of therapy that you can give to yourself without the prices, without the doctor visits, just how it can really, really change around a situation, no matter the diagnosis. So I guess what we'll start to focus on today is really, have you ever heard the term, music speaks what cannot be expressed? So we're going to go to Tirzah first here as the therapist and ask her what that really means to her and her interaction with her patients.
Well, you're going to put me on the spot, are you?
Yeah, I
am. Wow. I was thinking about music as you were talking, and I also work at Persoma PC. We have an association with Seclair, and in order to have some soundproofing, we put some music on in the hallway so that when people are walking through the hallway, they're not, hearing other people's sessions. And unfortunately, that music gets under my door, and I find it drives me crazy. So there's always a battle there between the therapists who like the music and me, who would prefer to have a white noise machine on, because music affects my mood. And so if I'm with a client, I don't want my mood to be yanked around by music that I didn't choose to have. Or my clients. There was one time I was treating someone and we were doing some meditation exercise, and all of a sudden, someone had put on some kind of really clashy music, and there was that blah, 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 coming in, and I'm trying to get this person relaxed, and I was like, oh no. So music does have certainly a big effect on me. I can't have background music. I have to choose to listen to music because I respond to it emotionally, and I think many people do respond emotionally. In fact, I'm going to knock this back into your court. All three of you were at the State Hospital. Was it yesterday?
Yesterday,
and you
yes.
had a music experience with patients there that you've been working with for a while, and I understand that was a pretty extraordinary experience. So I think that experience is probably going to be more interesting to our listeners than anything I can say. So why don't you talk about what your experience was?
Yesterday we had James play the guitar at Torrance State Hospital, and we just noticed throughout the whole time there was barely any patients at all in the room prior to the start. I'm not sure if they didn't know about it because it was the first day we did this. Eventually over time, patients just kept coming in, so by listening to the music, they were all energetic. We haven't seen them like this at all. They were so lively, singing, dancing, tons of good music. He took requests, and he offered to bring additional music next week. So we're going to plan on doing this every week, and it seems to be very beneficial to the patients.
Yes. Also, a lot of the patients there had trouble talking about their feelings, and we found through music that they were able to relate and discuss how they felt. James played a number of songs that he had written himself, and we got the background on each of those songs, and people could relate. Like one song was about his mother, and we all have mothers, so we were able to talk about our mothers and things like that, and the patients were able to connect, and the whole room was full of discussion and joy. It was a very nice day.
So the music provided an entree into those subjects that you wanted people to talk about.
It was like an icebreaker. Yeah.
Excellent. And you were indicating that, Ashley, right?
Yes.
You were indicating that it just started out with a small group of people,
Yes.
but people were attracted to the music. And that is something that happens. I mean, have you ever been any place and there's a busker, on the sidewalk, and you're walking along and somebody's singing, well or poorly, it doesn't matter. You're attracted to it. You stop and you listen and maybe throw a few coins in. We can't avoid listening to music. It's a universal language. And so, everybody reacts to it. Everybody responds to it. So, and you found that out. What was your experience, Rachel, with?
Well, the interesting part about what you're saying there is that I think we've all voiced thus far with our experience on the ward yesterday and just how it brought out these emotions in our patients that we have yet to see. That how interesting it is that although music is such an escape for almost anyone that I know, it's also a return to reality. You said it's impossible to escape music. So yeah, it's there and it takes you to a place. Maybe if you're upset, you're going to listen to fast-paced, happy music. If you need to calm down, maybe some jazz, maybe some, just low-tempo music or whatever. Yet, as the reality standpoint, it almost validates your feelings. I'm in a great mood. I'm not going to listen to some type of music that upsets me or brings down my mood. And it works the same, vice versa. So it is an escape, and that's why it can be used as therapy. That's why it is the cheapest kind of medication. But it grounds you. It's a reality that, once again, no doctor appointment or alternative cure for some sort of diagnosis, that can't bring that to the table. It's both aspects.
So you're feeling pretty positive about using music with people. There's something I read once about music, country music, and the tempo of country music being associated with low mood, and that when people listen to a lot of country music, they get in touch with depressed feelings. So it strikes me that if one's trying to self-medicate with music, one needs to be a little bit careful about what kind of music they use. And you mentioned, you might use a music to counteract a feeling, or you might use a music to heighten the feeling. I remember when I was in college, my mother died, and I spent a lot of time listening to classical music that allowed me to get deeper in touch with those feelings of grief. And I want to escape them. I wanted to feel them, even though it was painful. And certain classical music, I remember listening to this one particular piece by Sibelius that I loved at the time, and for hours and hours and hours, and just allowed me to stay in that feeling. So I think it's an important adjunct to any kind of treatment that we use, and I can't say that I've done much with that, but hearing you guys talk about the experience makes me think about, all right, how can I introduce this into my work with people?
And one thing I find with yoga, because yoga, a lot of people think of music being so closely associated with yoga, but at the same time, it's not. It's like it's a dual-edged item there, where you do it in silence and just with yourself. But I am very choosy about the music that I present into a group class, because I really wanted to set the backdrop for where I want to take the group. And for what they can latch onto, with how I'm going to phrase and flow the class.
How do you decide what kind of music to choose?
Intuitively. It's just intuitively. I kind of set an idea of what I want to do with a particular class. If I want it to be more of a intense, slower class, or something more at a working pace, or anywhere in between that. If I want it to be more meditative or more of a fun discovery type, then the music, I'll know what I want to put on as a backdrop. And when I work one-on-one with patients, I always make sure I have music on. I very seldom will not have music on, because it's that important as a backdrop for them. They don't even know that it's helping them. So I put it on so that they can have something that's helping them to focus through the session, to if they're working with anxieties or depressions, that's going to subconsciously feed them if they're not focusing on it in a conscious manner. And it really does help the work that I do get a little more in the door.
Julie, you're a Reiki master, and I think of Reiki in the same kind of category of other body work, energy work, like massage therapy and
Yes.
Some of those. Do you use music?
I
with
do.
clients?
I do. I always use music with no words because I want the client to be able to go where they want to go.
Not necessarily melodic that they would have to pick up.
Right. It's a lot of more ambient, meditative, usually very calm. Sometimes some drums, but that depends on the client. But I find that it really is very helpful. It allows people to relax, and if they want to follow the music, I have had clients comment on how much they enjoy the music, and others have said they didn't even realize it was on. So it's
just so much a part of the experience that they couldn't parse it out. So we talked about music being used to help heighten an experience and stay where you are. Music to distract yourself from an experience and find another.
It goes with the body work, or it goes with the yoga or something. I read somewhere the quote, "Music washes away from the soul the dust of everyday life." So you do those therapies, you do that body work, you do the yoga to kind of let go of your anxieties, your depression, your emotions that you wouldn't be able to get out in everyday life. Everyone's so busy and running from here to there and so concerned with maybe others in their life or whatever. They don't get to take that chance to just calm down, allow themselves to partake in the yoga, partake in Julie's type of therapy, and just let it all go, let it be washed away, and it's a great therapy.
But you were in a place in the hospital where you were using music to help people, get in touch with themselves.
Absolutely.
But you also were providing a structure for them when they did get in touch with themselves.
Right.
You had a group, you were discussing things, you were helping people. Yeah, exactly. You were helping people process that experience. So it's, that's something that's also important to think about. If people are using music, do they have the supports they need? You start identifying a strong feeling. What are you going to do with that strong feeling? And do you know what to do with that?
Not only are we listening to the music this week, next week we're going to start getting the patients involved with drums. There's jingle bells, and I think that will definitely help them open up more. Like Rachel had said earlier today, there was this patient that we barely even heard speak before. Well, she was all wanting to request songs and everything, and she was showing me how to do the little drums because she knows how to play them and stuff. So it was just amazing to see her open up like that through music.
Well, we also had a chance to sit in on some group therapy sessions and at Claire, and we had a guitar playing a couple times by an intern, and we all meditated and just listened and focused on the music, and we're being taught to be in the moment here, and that's one of the therapeutic skills that are taught to the patients. And it's a good way to, if you're stressed or anxious, you can change your mood as well. So that's, a lot of people think they have to have an anti-anxiety medication or they need a drug. Well, here you can relax and change your mood with music as well as bring out a mood. So you can manipulate music however you want.
But that doesn't make money for a pharmaceutical company.
No, but
and you're not going to see any commercials on TV for using music. And you married those two themes as you started out today, Rachel.
Absolutely.
What's your thinking about that?
Isn't that half the issue? Isn't everyone so concerned with how am I going to pay for this medication? How am I going to get my insurance to cover this doctor visit, this surgery, this therapy? I mean, you can go home and turn on a stereo and there's some of your self-soothing right there. And I think that makes such a difference, and I don't think it's realized enough. While the media portrays commercial after commercial of, no, this antibiotic is the best, this drug is the best, this is what you should use for your allergies, this is what you should use for your migraines. Well, why can't you come up with your own method? Sure, medications and surgeries, they're going to be needed, but you should take every step possible before you get to that point. I don't think it's realized enough the little things we can do for ourselves. Go to a yoga class, turn on your stereo, and
don't you love
all the difference.
Don't you love the advertising You know, they tell you all the great things. I have to wind myself up, and now I'm happy. And then the
side effects,
you know.
10 minutes
on
later,
Tuesday, your ears will fall off.
Yeah.
You know, if you take this,
you may die.
But even so, though, those companies also use their music as a background to get you to pay attention to their music. So they're still using it as
Absolutely. No one would take the time to realize that, but isn't that the truth?
That's a good point. And
so I think our main take-home message of today is how much music can affect your mood, it can affect your attitude, and if you can have that accomplishment of gaining a positive outlook or gaining a hope to be better or to improve your condition, isn't that half the battle? So I think that's something that can't be
talking
taken
about
away.
personal agency, you know, taking charge of what you need and doing something.
Absolutely. No diagnosis can bring you down without your permission. So if you keep that outlook, you're going to improve, whether it's your actual health or it's in your mind or something. Music is a perfect means to accomplish that.
And if you have like some type of anxiety or panic disorder, if you just realize that you're developing this, you may be able to use different methods such as the music or deep breathing or anything learned here, any skills learned here at all, prior, and see if that works before you may need some type of medication to help you. So you should definitely try methods prior to.
Anybody in here ever tried drumming?
No.
Oh, I did. I went to a drumming session. Wow, that was wild. That was so great. Yeah, because I wanted to make the point that it's not just if you feel that you're in this having mental maladies. It's for everybody. It's for everybody to be able to have that connecting in their lives when there's a little crisis that comes in emotionally, because we all face that. But yeah, the drumming is absolutely great because all the apprehension about what am I going to do with this drum. I have to present myself into a music session, and then you have to just let go and let it happen.
And that's the neat thing about drumming is that we have a drum with us at all times. It beats our heart. Boom, 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 boom. So rhythm is inborn in human beings. Rhythm is wired in. Our hearts beat in a rhythmic way. So there's no such thing as not being able to play a drum. Everybody can do it. You know, you just start out with ba-bum, 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 and now you got a rhythm. And no, it doesn't matter what you beat with. You know, you know the group Stomp? You're familiar with the group Stomp? You know, they use absolutely anything they can find around to make music with and to make percussion sound with. So we've got that ability. And I've had a chance to do a lot of different drumming things. And, you know, I went to a conference once and had about a 2.5-hour drumming session one night. It was just fabulous. 30 of us in there with everything you can imagine, just drumming away. And it was wonderful, is that drum circle was very meaningful. And then once I had to have an MRI several years later, and I was really nervous about it, and I went in, and, you know, I have a little claustrophobia, so there I am in this machine, and it's making all these noises, and it was like the first thing that hit my consciousness was, hey, drum circle, you know, this sounds like the drum circle. So I was able to just kind of get myself back and see those rhythms and just kind of play that in my head. And a couple times the tech said, you gotta hold still, because I wasn't holding still, because I kept going like this, you know, for the drums. So that's something that you know, hopefully you'll be able to introduce drumming. It sounds like you're going to with the patients there, and they can find that rhythm. And each of us have a different rhythm. You know, each have a note that resonates in our bodies that you know, we're attracted to. So when I go look for a drum, you know, I beat them all, and then I know the one that resonates with that note for me is my drum, and that's how I select it.
Yeah, and there was an interesting thing I saw. This was many years ago, in relation to music and plants. Probably 20 years ago, and where they had an aquarium type area set up, and they were growing some plants, and it was separated in some fashion where one side of the plants were exposed to rock music of the day, and the other side was exposed to classical music, and the rock plants died and the classical music did not. So take it for what you will. That was a study that some people were doing.
That's interesting.
Yeah.
I'm kind of partial to rock, so my plants haven't died, so I think it's just kind of self-select.
Plants within. Keep on living as long as the rock keeps playing, right?
Yeah. What were you going to say?
Well, while we were talking, it just came to mind, the music industry is one of the most profitable things as well out there, and that just validates how in our population music is so important. You know, think about movies, background music sets the tone. you could set the tone for your life with music you play. You know what I mean? And you were talking about drums. Beat to your own drum. You know,
Right.
you ever hear that? March to your own
March
drum.
to your own drummer,
So
absolutely.
really, I mean,
Finding your own rhythm is very
yeah.
important. Yeah.
That just came to my mind.
So there you have it. There might be 1 or 2 therapies per diagnosis you have, but I don't think you'll find a medication out there that will cure each and every one of your medical problems, except music.
There you go. There you go. And you haven't said anything, Michael. What do you think about music?
Metal, so
Those plants are definitely dead.
Do you have any
Absolutely
my plants are
dead.
so dead.
Funny because patients yesterday were requesting Slipknot, Metallica, and we didn't actually have the means to play that for them, but it was a request. So there you have it. Everyone wants their own.
I listen a little bit of that. I listen to some rap, a little bit of everything, really. And classic rock. I mean, go from AC/DC to Garth Brooks to Insane Clown Posse, whatever. But a lot of times I listen to that to get like that frustration out. Like it not something. I get into it and the energy's out and I can carry on like a normal person. Can you speak to that? Is there a place for that amongst people normally? You think, or maybe even in therapy? I don't know.
Place for.
Like the harder music,
Yeah,
the
outlet.
Slipknot.
It's an outlet
Sure,
for
absolutely.
frustration.
Absolutely.
Mm-hmm.
Yeah.
Well, I mean, what's the difference between banging a drum? It kind of like goes me back, like in my day, I've been to the Ozfests and everything, and seen the mosh pits, and people, everybody's banging their heads and pumping their fists, and maybe in the mosh pit bumping around. Some of the girls bumping around too in the mosh pit. But it gets a lot out.
It does. When I look at that kind of behavior, it reminds me of some of the things I've seen of African tribes and Native American dance, which is not melodic. It's boom, 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 and it's just and they're just going and going and faster and faster. And there is something you get out of yourself and kind of merge with whatever.
Some people get drunk and take it too far.
Well, yeah. I guess those mosh pits aren't called mosh for nothing.
Therapeutic to you, anxiety. Take your choosing. Teach his own.
And I think it's pretty true that the music of your youth is the music that's most special to you. James Taylor, I grew up with the soft rock. James Taylor is my man, and my kids actually enjoyed it, but finally we used to listen to it all the time on road trips, and finally there was a rebellion that if there was any James Taylor in the car, then we're not going on the trip. So, and now they're older and they appreciate James Taylor. But
isn't that always the way? Like people my age are usually like, nothing got better than Nirvana and nothing ever will.
That's right.
Everything stinks since. I mean, isn't that whatever was that level? Like my father-in-law insists that Ozzy Osbourne is the greatest musician alive, and that was the music of his youth.
That was the music of his youth, exactly. So what's the music of your youth? And we're sitting here, 3 of us in our, over our youth time.
I enjoy Journey and all those old bands.
Okay.
Yes, and the Eagles.
Oh,
There
I love this guy.
seems to be a
It is a throwback.
I like some now, but I just don't think anything can compare to those.
Yeah, I like this woman. You
know.
can come to my house anytime. Now, what about you?
Me? Actually, I like a variety.
Right,
I like
music.
all types. I don't have a specific one.
Yeah.
I'm not a country girl, and I'm certainly not even close to a rap girl.
Yeah.
So I do more rock. I'm a big Dave Matthews.
Oh, yeah, alternative.
One
Yeah.
of those.
Yeah.
But I did grow up listening to the Beatles and the
Oh my
Carpenters.
gosh.
And,
Okay, yes.
Pretty much 3WS. Try to take a road trip in your car 4 days long to drive to Disney World and only listen to 3WS from start to finish. Trust me, I know all the songs. But yeah, I do like a variety, but there's certainly some that I prefer over others. Absolutely. But I was brought up around music. My parents love music. I have a boyfriend who is in a band and plays music. My brother moved to Philadelphia to be in bands and music. So it's played an important part. It was my childhood, and hopefully it'll be a part of my future as I start to treat patients and maybe coach them through my beliefs on this particular topic and how I really do think it's therapeutic.
Have we talked much about performing music?
Performing music?
Or like that angle of it? Like I'm somebody that I was trombonist in school, choir, started a rap group for a while, and it was like it was fantastic. You know, I mean, just that feeling of producing that music for people.
Yeah, it is. I go to a Hebrew chant group once a month, and it's amazing. It's just an incredibly transcendent experience, and I get a chance to do a little drumming at the same time, which is great. And I've found many times just sitting with a drum and just playing and just, you know, I'm gone. You know, my hands are just doing the thing and I'm gone. It's incredibly relaxing, but doing that also with chant is, you know, it's quite amazing. So producing that, and I sing as well, and yeah, so making music is wonderful.
Yeah, in our yoga trainings and different sessions that we get together with our peers and have sessions, we'll do chanting. And then we have some little instruments that we might do, and they get passed out and they get passed around, and everybody gets to add a little bit into the percussive end. And it's amazing, and we'll even have a couple of different chants going on at a time, and it's just an amazing feeling of when you get on that vibrational frequency by the self-made sound, of how that really affects the mind when you're done, and it just puts you on a different wavelength, and that has its own healing effect upon the body too. And it's really, if you haven't been in a room where there's a lot of chanting that's happening, because it doesn't have to be a Sanskrit, it can be of any language that's chanting there, because we do them in different languages
and
too.
Even just sound.
And yeah, it's just
sound.
Yeah, it's such a treat to be exposed to that.
Well, and kids make music. If you watch children out playing, especially if they're playing by themselves, you know, they're humming along and they're making music and they're making noise, and it's pretty amazing. We're music. People are music oriented. You know, it's a part of human experience. It's pretty amazing. So I like to not close the door on any kind of music, although, you know, there's some that sometimes my ears can't take. Like, you know, I have a little trouble with some heavy metal, but, you know, if I'm in the right mood. But I was even listening the other day to rap, and I'm not much into rap, but this guy was really good, and I was like, wow, I really like, because I liked his percussion actually. So I was getting into his percussion, and then I started listening to the words and thought, wow, I like this. This was pretty good. So it helps, you know, introducing people to different genres of music helps to open them up, and being open is a good thing.
Absolutely.
So glad you had this experience. What are you're thinking about the work that you're doing? Some of you will go into psychiatry, others of you will do other kind of medicine. When you think about how you might be able to use medicine in your practices, what do you think?
For me, I would recommend for music to be calm and relaxed. You know, it's a very good soothing mechanism. I would just, I don't know, if patients are sick, you know, with the flu or anything, just maybe get in a bath and listen to some music just to help calm and relax yourself, take you somewhere else, try to get your mind off of the sickness. Maybe, my mother always says, you know, just take your mind off, it'll go away, you know. Sometimes it works, sometimes it doesn't. I'm not very good at taking my mind off things, but I would definitely recommend it.
It helps with the mindfulness and staying focused on the moment. How about you?
Well, you could even do simple things like play soft, relaxing music in a waiting room. That sets the tone for when you're going to go see the doctor. I mean, you can have it throughout your practice. Recommend it to patients who are high-strung or whatever, and then any other type of diagnosis. And, I definitely think I'm going to incorporate it.
Yeah, I've definitely done that in my waiting room when I had my own practice. I had music playing in the waiting room for soundproofing, but also I chose selection so that when people came in tense, by the time they came into my office, they weren't tense anymore. Exactly. But I can't remember the last time I went into a physician's office and heard music play.
Really? Well, that might be a good thing to start.
So there you go.
Well, where I go, because of course it's alternative, they work with the music there too. Yeah, the music is a nice backdrop.
Right.
Yeah.
Right. So we can all think a little more creatively about music in our lives. One thing we were talking a little bit in a different podcast about the noise of technology and the ever-presence of music everywhere, even when we don't want it. Filling up your car at the gas station, there's music playing. You know, you're in every restaurant, there's music.
Soundtrack to your life.
Yeah, that's right. And then we have the idea of muzak, you know, the elevator music that just nobody likes. That's, you know, overproduced, you know, badly produced, somewhat familiar something that's playing that we go, oh my God, please shut that off. So we're talking about music as a healing force and as something we want in our lives, we want to choose. But what about music that's foisted on us? Music that, that we can't get away from. What do you think about that?
There you go. That's when your escape mechanism comes in. Do we always want the problems that we're presented with? Do we always want the obstacles, the hard times, the unwanted emotions? No. It's something we overcome. So there you are. You're presented with this material thing, this annoyance that you can't get rid of. Well, there's a lot of things in life that you don't ask for.
So what do you do? What do you do in that case when you've got this music, and what do you do with it?
I think that's when you close your eyes. I think that's when you go to your mindful place, and that's when you have the strength from past times, whether it was music, whether it was your yoga or your treatments, or that's when you go to your mindfulness, you go to your own peaceful place and have that self-soothing mechanism within you that regardless of the problem that's presented, the unwanted music, that you have it within yourself to calm down.
So there's the irony. You use music in a healing way to prevent yourself from having to deal with music that's foisted on you.
Absolutely. Knowing how wonderful it is, it can't be forced upon you.
You can't have the good without the bad.
There you go. Okay.
Very true.
And I would just close my ears.
There you go. So sometimes we're not going to want the music that's presented to us, that's out there, and we have to deal with that as an irritant, like any other kind of irritant. But other times music can be a force for good.
Which is a perfect metaphor for life itself.
Yeah.
So it all works out.
Where does wisdom come from in all these young people?
An endless cycle.
Yeah.
Fantastic. Thank you all for joining us. This was a great conversation.
Thank you.
Makes me want to go listen to some music.
Yes.
There you go.
That's all good.
Every day in the car.